questions right now about the coronavirus and COVID-19, the respiratory disease caused by the virus. So Health Texas primary care doctors are here to give you some answers. Dr. Christy Clark, President and CEO of Health Texas, joins us now. Good afternoon.
Good afternoon. How are you, Fiona?
Hanging in there, as I'm sure everybody is, right? So people
That's all you can do right now.
Following orders right now and staying home, but they still have to go to the grocery store. And when they do, should they wear a mask?
So that has been the question on everyone's mind. And I think that most lay people have really been thankful that the White House, the CDC, the Surgeon General, and our mayor came out with some recommendations on that. So initially, if you'll recall, we told people only wear a mask if you're sick. And then later on, we were really only wearing a mask if it's medical personnel. So over the past, over this whole virus pandemic, what we're learning is that people shed virus even before they're symptomatic. So in other words, if you're walking around the grocery store, there could be people with coronavirus that don't have any symptoms, so they don't know they're sick. So last week, the White House and the Surgeon General said it would be okay and advisable if people started wearing what's called a social comfort mask. So if you're going to the grocery store where you can't control that you're 6 feet away from people, it's perfectly reasonable to wear a mask. Still, though, you have to remember, the goal is you still need to be 6 feet away from people. So if you have a mask on, you still need to stay that 6 feet. And so if someone is not wearing a mask, you need to make sure that they're staying 6 feet from you. This was good guidelines, I think, for the city, and I noticed that people are already following that.
Now, for those who get tested for coronavirus, is it possible to get a false positive or a false negative?
So a false positive would be very, very unlikely. These tests are very sensitive and they're very good, Fiona, and they actually test the genetic material. So it is possible to get a false negative. If you're very early in the infection, you may not have enough virus particles, and there may not be enough viral particles to actually make that test positive. That being said, if you're very late in the disease, you could have cleared a lot of the viral particles from the back of your throat and your pharynx and down into your lungs. So you could also get a negative test if you're very late in the disease. So for those reasons, physicians who have a strong clinical suspicion that their patient has coronavirus, they are retesting. False positive, though, just really wouldn't happen.
So for people who do get the virus, are they protected from getting it again?
You know, we don't know the answer to that yet, and we're learning every day. This is new for us. We know that the typical response of a human being is to make antibodies. We do know from people who have recovered from the coronavirus that we do indeed make antibodies, but we don't yet know how long those antibodies will last. We also don't know how much is a sufficient amount of antibodies, and we just haven't had enough information, and this truly a novel virus hasn't been around long enough for us to really know the answers to that question. So more to come on those.
It's still flu season. Can you get the coronavirus while you have the flu?
Yes. So people can get more than one infection. It's called a co-infection. So yes, you can have flu and coronavirus. If you have the flu, of course, your physician will put you on medication for flu. There's no treatment for the coronavirus. The good news is we're coming out of the flu season. We're on the tail end of it. So most people are not having flu right now with the coronavirus, but you still can have other types of viruses as well.
Dr. Christy Clark, President and CEO of Health Texas, thank you so much for all that information. A primary care physician is your first line of defense right now. They know you and your medical history. For more information on Health Texas primary care doctors, give them a call at 210-731-HTMG. That's 210-731-4864, or visit their website, healthtexas.org.